My family member has delirium. Now what? Have you heard the term delirium being used but unsure of what it actually means? In this presentation, we will be discussing what delirium is, signs and symptoms of this condition, and what you can do to help. Delirium is a condition that affects the brain and thinking. Delirium is different than dementia. Dementia usually happens over a period of time, whereas delirium happens suddenly and may seem out of the blue. Delirium can last a few hours, a few days, or a few months. Everyone experiences this condition differently. Many people are affected by this condition. As many as half of the people in the hospital have delirium. There are many things that may cause delirium. There may be factors contributing to the development of delirium, and these include stress, dehydration, illness and infection, surgery, an unfamiliar environment, poor nutrition, pain or fever, and some medications. These medications are meant to help your family member get better, but often have side effects that may cause delirium. Again, delirium may be caused by one or more of these factors. There are also many signs and symptoms of delirium. The first is confusion. The individual may forget where they are, what the day is, what year it is. They may even forget familiar people. They often are not able to understand what is happening around them. They also show a lack of focus. The individual may be easily distracted from the conversations that you're having with them. Individuals often show sudden changes in mood and behavior. The individual may be upset. They may be yelling, anxious, or aggressive. They may be all three of those things. On the other hand, the individual may be quiet. They may not be talking to you or responding when you talk to them. Similarly, there may be changes in the individual's sleep. They may show signs that they are more tired and drowsy than normal. Lastly, the individual may be experiencing hallucinations, where they are seeing or hearing things. These things are not actually there, but feel very real to the individual. You, as the family member and caregiver, are important. Research has shown that family involvement helps to prevent delirium. You are able to identify signs and symptoms of delirium early. You are also spending the most time with the patient when they are in the hospital and at home. You know what behaviors are normal for the patient and what may seem out of the ordinary. There are many things that you can do to help your family member. First, you can remind them of the day, including the day of the week. You can also remind them what time it is. So if it's morning, afternoon, or night, just let them know so they are aware. You can also remind them of their situation, what happened, and why they are in the hospital. Next, it is important to provide glasses and hearing aids to ensure that they are able to see and hear what is going on in their environment around them. Bring in familiar items like pictures and cards to attempt to make their room more familiar and homey. You can also talk to them about familiar people and places. While they may not respond to what you are saying, this is providing them with the information needed to keep them rooted in reality. Next, you can play their favorite music and TV shows to give them something to focus on and listen to. You can also work with the healthcare team to assist in creating goals for your family member. Again, you know them best. What things are important to them and what do they want to get back to doing when they leave the hospital? You can let the healthcare team know these things. Next, you can provide encouragement to them to keep their spirits high. This will also help them to feel supported during this tough time. Next, you can also help to establish routines for the individual by doing things such as coming in at the same time each day. If needed, you can also assist the healthcare team in determining how to communicate best with the individual. Last, you should communicate with the healthcare team if you notice changes in your family member's mood or behavior to assist in identifying signs of delirium early. During this time of COVID, there have been more restrictions with visitor policies in the hospital. There may be visitor restrictions for COVID, or there may be visitor restrictions for other reasons. Family member presence is still important. Here are some suggestions on how to be present without being physically present. First, you can drop off glasses and hearing aids, as well as familiar items. This may take some collaboration with the healthcare team to determine when and where to drop off these items. And this leads into the next suggestion. Talk to the healthcare team. Communicate with the team to ask questions, be involved in your family member's goals and plan of care, as well as learn new information about how your family member is doing. If you are able, call or video chat with your family member. If you are not able to call or video chat with them, then maybe think about recording a video or a voice message that the team can play for the individual when you are not there. Last, be creative and think outside the box. What can you do to make your presence known with your family member when you are not able to visit? If you take anything away from this presentation, I hope that you understand that you are able to make a difference in your loved one's delirium through your continued support. Thank you for listening to this presentation. I hope you feel empowered to work with the healthcare team and your family member while they are in the hospital. Here are my references.